your first and last?
Yes, sir. Jason Dougherty, JASONDOUGHERTY, and I'm the Deputy Chief of Operations, Hillsborough County Fire Rescue.
So yesterday we heard that, and I believe the number was 60, but correct me if I'm wrong.
Yes, sir.
Fire rescue personnel that are currently in quarantine.
So currently we have 48 fire rescue personnel in quarantine or isolation by fire rescue's definition. Yesterday we did actually have 63 in quarantine. We were able to return a few individuals back to work, so that number changes on a daily basis based on our folks coming in contact or exposed to the COVID-19.
Was this as a result of multiple incidents, or how exactly did those fire rescue personnel encounter those individuals with COVID-19?
Initially, some of the folks were off for travel-related reasons, traveling through international airports, traveling internationally, being on a cruise line. The folks that are actually off quarantine or for exposure cases, we may want to stop. Sorry.
It's okay. What mentioning how many you've got, so we understand how many people.
You may want to have them, Chris, you may want to have them pull down further.
Is it 48, Chief?
Yes, sir. Yes, sir, right now.
You didn't say confirmed cases, did you?
No, sir. And I'll talk about the difference.
Yeah, sure. Differentiate between the numbers there.
I'll start back over. What were you?
So, you said 48 currently on quarantine, but you also mentioned that some of those were because of travel or being on cruises. So, how many as a result of their work, encountered individuals who've been directly exposed to COVID-19?
So, initially, a lot of our quarantines were due to travel related and being on cruises or what have you. Now, most of our folks that are quarantined or isolated, they're on that because of being exposed to the COVID-19 virus going on calls. We have over 1,000 sworn personnel with Hillsborough County Fire Rescue. So currently we have the 48 individuals off. We do have 2 confirmed COVID-19 firefighters that are infected by the virus. One is actually scheduled to return to work next week, and the other one's still being going through medical clearance.
So again, were these multiple exposures? In other words, multiple calls, or how did they get exposed?
So when somebody gets quarantined or isolated, it's based off initial exposure. But our folks are running, multiple calls a day. The unit's running multiple units, multiple calls, multiple places a day that they are most likely getting exposure. But when they're quarantined or isolated, it's due to a direct call, a direct exposure, where we know we have a COVID-19 individual that they've got exposure from, and our folks either were unable to don their PPE or did not have the PPE on based on the nature of the call.
So I know that you have 1,100 sworn personnel, and this is dispersed throughout the department. But would you, as we get into the peak, which is anticipated to be May 3rd, would you anticipate that you might need retired firefighters or fire rescue personnel to come back and assist the ranks here?
So it is a tremendous challenge to have our folks be able to keep running to the calls and not end up in isolation or quarantine. Part of that is by how we respond. We've changed our response policies based on CDC guidelines, DOH. So the way we respond with our personal protective equipment, some of that has changed from the initial way we're responding. So we're trying to control how much isolation and quarantine we're getting based off exposures. We've also changed the way we're dispatching calls and responding to calls. We use a screening tool with our dispatchers to give our folks a better idea of when they're running to the calls, what they may be running into. We implore all the members that call, all the people that call 911, all our patients that call 911, please be honest with the signs and symptoms they're having. That gives our firefighters the best opportunity to protect themselves from the virus. Regardless, we're going to absolutely take care of any individual calls 911, but it's very important if they tell us the signs and symptoms so my folks can be better prepared to treat the patients.
Would you need, as this curve continues to escalate, would you need other people to come in to facilitate or beef up the ranks?
Right now, Hillsborough County Fire Rescue, we feel comfortable with our numbers, and we're a large department. We're one of the largest departments in the state of Florida. We are, like you said, going to be very affected with the peak predicted to be in, beginning of May. So we do look for our isolated and quarantine members to go up, but currently our folks are dedicated to the job. They're showing up to work every day. The ones that aren't isolated and quarantined, they've canceled all their vacations. They canceled all their leave. They're coming to serve the community and do what we're here to do.
Do you know how fast they're getting tested and then how fast the turnaround is? I know in some parts of the country, maybe not here, it may take 9 or 10 days till they get it back. Are you guys getting streamlined since you're on the front lines?
So it depends where our folks get tested from. If they're tested through the Department of Health, it's a quicker process. If it's tested at a private doctor's office, private physician, it's usually sent out to a private lab, which takes a little bit longer. Sometimes those results are taken up to 8 days at this point. So right now we try to go through the Department of Health, and that's based on signs and symptoms. And if we go there, we usually get those results within a day. We also have rapid test kits that Hillsborough County has purchased. We're hoping to get those in the next week or two. And once we have those, that'll help get our individuals not necessarily back to work quicker, but to let them know if they've been exposed and where we're at in that process.
Do they have to jump through hoops to get tested? Like, I know that, if you call in, they're like, have you traveled to China? Have you been exposed to anyone that had it? Or are you guys just saying, look, I think I have it, I should get tested?
So first responders are still required to go through a screening process, but there is a priority made for the first responders based on their exposure, based on almost every call we're going on at this point in the community, we're being exposed to some type of COVID-19 symptoms.
Can you give an example of that? Just something where someone got it because they went on a call because someone called because maybe they had chest issues and they were going down fast, and then you guys respond to save them? Because a lot of people are being told not to go to the hospital, but then they can get sick within an hour after calling,
Let me understand your question a little bit
Like,
better.
are people at home, like staying at home, not knowing if they have the virus or not, and then they're like medicating themselves or just hanging out, and then they deteriorate rapidly and they have to call you guys in and they have the virus, and then you guys have to rush there to respond? Are you getting a lot of calls where people are deteriorating rapidly, where they've been staying at home, but then they're getting sick fast?
I don't think I have really exampps of that right now at this time. The data's probably not enough data to support that right now.
Any other examples?
When we go on calls, most of the calls we have to screen for the COVID-19. Most of the time we don't know if it's a COVID-19 positive patient unless that patient has already tested positive with Department of Health or somewhere else, and that's reported back through us back through the Ryan White Act. But most of the time we're going on suspected COVID-19 patients.
Based on your change in procedures, how are you doing with the stockpile of PPE?
So the PPE which is our personal protective equipment. It's a challenge. It's a challenge not only locally but nationally, having all the essential supplies that protect our first responders. That's probably one of our biggest challenges right now. That's why we reach out to the community, other folks, private vendors. We're reaching out to every vendor we know. We're working with emergency management, the state emergency management on federal and levels as well, to try to be able to equip our folks with personal protective equipment so they can better serve the community.
So you have enough for today, but what about tomorrow, next week?
So right now we're comfortable with our PPE, but based on the predicted number of call volume and number of COVID-19 patients we're having, we definitely need more PPE.
All of you guys have to jump in a fire truck together, so they're not really able to do that social distancing that we're able to do. Anything they're doing internally in the firehouse after calls?
So what we're doing to help protect ourselves and also to be better prepared to serve the citizens of the community is we do health checks twice a day at the station. So when we come on duty, we do a health check. It's required to be logged in and make sure that nobody has any fevers, nobody's coughing, nobody's sick, what have you. We do that 12 hours through the shift because we have 24-hour shifts. We also require to log that to make sure none of our folks are sick. After each call, each unit's clean by the standards set by the CDC and the Department of Health. So we're making sure all our equipment's clean. If we do have any suspected COVID-19 exposures, we also, if they don't meet the requirement for isolation or quarantine, not only we clean the units, but the employees are changing out of their uniform into another uniform, taking a shower before they return back to work.
Can you talk about their morale, how they're holding up? I mean, I know this is what they do, so.
So I think as a fire service, I don't want to say that any of us, necessarily knew that we'd be dealing with a pandemic, but it's what we're here to do. It's when we held up our hand and swore an oath, we knew we were here to protect the community and the citizens. So I'll say from a morale standpoint, our folks are absolutely engaged. They understand the challenge that we have set forth, but they're doing a tremendous job. They're doing an outstanding job. I couldn't be more proud of what our folks are doing. And so from a morale standpoint, I say right now, Hillsborough County Fire Rescue is ready to serve all through duty, honor, and courage.
Chief, thank you.
All right.
All 48 firefighters, fire medics, mix, or
It's a mix of firefighters and fire medics.
and then 2 confirmed?
Yes, sir.
Do you know how many tests are pending? Or all 48? Or what are
yeah,
the
we-
48, and then the 2?
No, not every member that's isolated or quarantined is tested.
Okay.
Some of them because they find out that they may have been exposed based on the testing coming back 10 days prior. So they decide to wait 14 days to be cleared. After 14 days, you can be cleared. But currently we have, I believe, 9 people have tested, and most of those have all been negative except for 2.
Thank you, sir.
All right?
Thank you.
All right, thank you.
Thanks, Chief.